If you're determined to age well, then you, my friend, are in the right place, because that's why we're here, to age well. Bloody well, in fact. Welcome to the Aging Project podcast. I'm Shelley Craft, your host and fellow ager. And in each episode, we'll dive into the nitty-gritty of what it takes to age well, learning from experts around the world and, of course, from each other. Why? Because aging well doesn't just happen, my friends, and each of us needs and deserves a support team. So you can think of us as your tribe or perhaps your cheerleaders. We're here to stand by your side, to propel you forward and spark yes you can choices at every age. We'd love for you to join our growing community. In fact, we're calling it a movement. And of course, try our free 5-day morning challenge over at theagingproject.com. It is a great place to start your aging journey, and this is a great place to kick off today's episode. Brought to you by youmusttryit.com, where you'll find supplements, skincare, and makeup. We've tried it, we've tested it, and we love it, and it's all in one place.
Medicine to date has been somebody walks off a cliff and we try and piece them together. But medicine is changing. We are now going to be the guardrails at the top of that cliff and trying to stop you from falling off that cliff. And that's where genetics and whole body MRI, two of the big pieces of that puzzle, will be at the forefront.
So about this time last year, I had a daughter who needed an MRI scan. Seems pretty simple. She had a niggling injury and in we went. Well, not really. This is where I had the privilege of visiting Mermaid Beach Radiology on the Gold Coast and meeting for the first time Dr. Zane Sherif. Here is where I learned about the future of preventative imaging, and it is quite an extraordinary journey. So I booked myself in for what they offered, being a full-body MRI. This is extraordinary, and as I said, the future of preventative imaging. For the most part, doctors will recommend a scan to diagnose a health condition, obviously something serious like cancer. But imagine a future where full body scans were something that everyone could access, like we do blood testing, to make sure that we are well, not just to check in on an illness. It's almost like an insurance policy to detect things very early, so that we have a good chance of doing something about them. Today, my friends, we are talking about the latest imaging technology available here in Australia, and it is all thanks to this guest, Dr. Zane Sherif. Zane, it is great to have you with us. I know this conversation has been a long time coming, and as you can tell, something that I am very excited and passionate about.
Thank you so much for having me. Yes, look, it's been a long time coming, and I couldn't be happier here to tell everyone, to all your viewers and listeners, about the amazing technology that is hopefully going to be very mainstream very soon.
So for a doctor that has trained and worked all over the world, what was it about this particular element of medicine and science that really got you excited?
Medicine is changing very rapidly. And the beautiful thing about technology is it touches radiology first. And I'm a complete nerd, self-confessed nerd. And so I just love the idea of all the new tech that comes in touches my specialty first. And then it transcends the rest of the specialties. But we've had MRI now for probably the best part of 30 years, and it is just moving so rapidly. But for really the first time, roughly about 5-6 years ago, a few things started happening in MRI science that allowed us to do these whole body MRI scans.
So most people, if they have come across a machine before, it would have been for perhaps an injury or, as I mentioned in the intro, if they have sadly been diagnosed with cancer, where an MRI machine can look deeply into the body and give you a much better picture.
Correct, yeah. So what you've just touched on there is exactly right. So medicine has classically been, and look, really for the most part still is, a reactive service. You get a tummy ache, a headache, a knee ache, you go and see a doctor and you get an appropriate scan. But medicine is evolving, thankfully, because in a large part of MRI, and there's another science as well that's evolving, which is genetics. So reactive is turning into proactive. So I just don't think, people nowadays have such a huge investment in their lives that they're not ready to be sick before they do something. They all want to get ahead of it. You go for a road trip, you'll take your car in while it's working for a service, while it's working so it doesn't break down. You don't wait for a breakdown, for a toe, and then say, hey, I better do something about it. You get ahead of it. And that's the attitude we're now changing. In fact, the one thing I say to people all the time, treat yourself like your car. Get it serviced regularly. All of this stuff is a snapshot in time. And what might be normal today is not necessarily going to be normal in a year. So it's part of a routine that you have to adopt.
It's really interesting. We have heard that analogy from doctors across the board in the holistic space. And isn't it sad that we do look after our cars better than we would look after ourselves? We had a lovely guest on, Dr. Anthea, and she calls it the space between, which is sort of when you're not sick, but you're not well, you know something's a little bit off, but no one can pinpoint it. And I think that's where a lot of us sit, this sort of space in between. So to take yourself in and say, right, I'm going to do something about it, it really is putting our health back in our own hands, which I am all for.
Absolutely. Everyone has to be the CEO of their own health because for you, it's personal. There's a lot of people in your life who are dependent on you. You are no good to them, incapacitated. So looking after you is actually your way of looking after the people that mean the most to you in your life. So it's not a selfish thing, finding a little bit of money, spending a couple of hours in a scanner. That's not being selfish. That's being very unselfish.
Can I say for me, as I said, I was in there with one of my girls and I saw your amazing brochure there advertising, full body MRIs. And of course, being the nerd that I am, I was like, oh yeah, bring this on. I want to give this a go. And it wasn't until I was robed up and ready and you had explained to me, yes, you'll spend, 2.5 hours inside an MRI machine. You have to lie there very, very still. And we're going to scan your entire body, top to toe, inside, outside, backside, front side, to see if there's anything that we can see. And it wasn't, Zane, until that point, I went, oh shit, what if they find something? And that to me, I then sat there going, well, better be here than not doing anything about it for 6 months or perhaps 6 years and then finding out. But there was that moment where I thought, oh my goodness, what will I do if something comes up?
That's right. And that's the driver for a lot of people. And I always say it's like going to medical confession. I mean, you feel so much better after it. But again, people say, I hear it nearly every day. They're still there, but they say, oh, look, I don't really want to know. The reality is they don't want to hear bad news. If there is bad news, what they want to hear is, we have got this guy so early that you've got time and options. The worst thing is not knowing. Not knowing doesn't mean it's not there. But when it comes knocking, you are out of time and options. But when you come knocking, at the earliest stage of the disease, you have time and options. And often T1 or T2 malignancy disease is the most treatable or if not curative. But T3 and T4 disease, the genie's out of the bottle.
So let's talk through the process. Obviously, there's a lot of different scannings. Can you take us back to the very beginning about what the difference is between an MRI, a CT, an X-ray, a little bit about the technology?
Yeah. So CT we've had for, probably I think it's just over 50 years now. And CT uses radiation. And it uses radiation that goes around and you go in a tunnel, it spins around and it acquires basically a volume map of your body. It's a decent amount of radiation. And we use that in our reactive when we're being a reactive doctors. So tummy pain, headache, etc. We put you into the scanner and we get quick answers quickly. But we can't use a camera that has radiation when you're not sick, because unfortunately there are side effects to radiation. And of course, the biggest side effect is cancer. So I can't put you in a scanner that causes cancer while you're feeling well. So to get into the proactive sphere, you have to be essentially well, and I have to put you in a camera that doesn't cause you to be sick over time. And that's the MRI technology. X-ray is the same as CT in the sense that it's radiation, but it's just one picture rather than slices. And then ultrasound, of course, has no radiation at all. It's a war technology like submarines looking for sonar. And then PET is another nuclear medicine, but again, PET has a high radiation dose. And by the time you get into PET, we're not really looking for cancer. We know you have cancer. We're looking to see how fast spread it is. And at that point, the radiation justifies the information we're trying to get. But assuming that you're well, this test is designed for somebody who's well, walking, otherwise healthy, wants to stay ahead of the situation, and they go in and get the MRI. The only thing I ask for is 1.5 hours. In fact, we got the time down from your last time. We're at roughly about 90 minutes. So it's 90 minutes. You pick the movie or the music that you want to watch. You lie there very still. We still need that part. And then, hey presto, at the end, it takes me about an hour. It takes the guys about an hour to stitch it all together. It takes me about an hour to read it. I have a few rules for reading it. I make sure it's very, very quiet, and I do it on a weekend because it's like reading a book. It's very hard to understand the chapter you've read if you have 1,000 interruptions. So I just make sure I've got some nice, clean, uninterrupted time, and it's like reading a novel. I can just read it all at once.
And that is actually reading someone's body from head to toe.
Correct. And people ask me, they said, oh, it must be a very easy scan to read because these people are all healthy. It's the hardest scan I have to read. And it's because I'm looking for a needle in a haystack that may not be there. Whereas every other scan, I've got somewhere to point me to where the badness is, a headache, eye pain, leg pain, whatever it is. I have some symptom that points me to where I should be looking hardest. In a whole body MRI, there's a lot of data that I have to sift through for something that may not be there.
So when you are doing that, obviously there's, I don't know, I guess colours shine up and the technology itself is quite extraordinary that it guides you to the places that there is a problem. What happens next? We get the report from you, good or bad?
Yeah. So I go through a very, very complex read. I split it up into systems, so the head and the neck and each anatomical compartment. I go through all the major organs in that and I see if there's anything suspicious. Now, not everything in the body bad necessarily is cancer. There can be other things like hemochromatosis in the liver or fatty liver disease or whatever it is. Obviously, the main question people want from this scan is, do I have cancer? And out of all the cancers, they want to know, do I have pancreatic cancer? Because out of a lot of cancers, pancreatic cancer is pretty much doing this. We don't exactly know why. I suspect it's like everything in life. It's a multitude of things, and probably pollution is one of the big reasons. And polluted food or dirty food. When I say dirty food, I mean food that is full of preservatives and artificials. But certainly, pancreatic cancer is on the rise in a big way. The problem with pancreatic cancer is even if you get it early, it can still be a nasty one to even treat. And of course, we all know the story of Steve Jobs with his pancreatic cancer. And that was picked up when he had another scan for a kidney stone, and they picked up the pancreatic cancer. So he didn't even have symptoms from that one.
That is sad, isn't it? And quite extraordinary too that you can feel perfectly well otherwise.
Yeah. And so I do that report. So it's quite a detailed report. It's a 3-4 page report. I go through every single organ, every single blood vessel. Well, when I say every single blood vessels that have a name, the small little capillaries we don't see and we don't mention. And then I get that report. I send that to you or to your referring doctor. At the end of it, I give it a grade into basically 1 to 5, 1 being essentially there's no chance this is cancer, grade 2, very, very little chance of cancer, and grade 5, this is cancer until proven otherwise. And then I make a recommendation to your doctor how we work this up to make sure. But really, very few of these end up in biopsy. Usually, it's so clear one way or the other that it's nothing or it's something. And if it's something, we usually 1 or 2 other tests, maybe a CT scan or an ultrasound to confirm. But generally speaking, in all the imaging cameras, medical cameras that we have, MRI is the troubleshooting camera. You'll find something that we don't know what it is necessarily on ultrasound or CT. We have an idea something's wrong, but we don't exactly know what it is. 99% of the time, that case will end up on the MRI to troubleshoot and say exactly what it is. So when you're already starting with the best camera in medicine, I can pretty much say on most cases what that thing is that I'm looking at. So I don't really need a lot of extra help. Very, very seldom I need. And that's a big question I get asked, do I need a plethora of other scans? And usually the answer is no, because we're already dealing with the best camera in medicine.
So if we're talking about this being a baseline and a proactive approach to our own health, say the scan is completely clear, that's not really the end of it, is it? That's the beginning, because now we do have that baseline. And like your car service, if you're doing this once a year, once every 2 years, a great way to start. Can you use the same images or do you compare images year in and year out?
Absolutely. Absolutely. So hopefully the first time you do it, the first time you do this scan, we do an extra comprehensive and we use that as a baseline. And then the next year, we probably don't need to look at the spine again unless you say, hey, I've had terrible back pain. There's a few things that we can economize on. So we can actually make that a bit shorter for you so it's a bit more comfortable. And then we can just go from there. But having baseline data like that, I mean, it's such useful data, and we keep it there basically for 10 years or more. And just like an ECG is a snapshot in time. It tells me what your heart is doing for that 30 seconds that we've recorded its activity. But that doesn't mean tomorrow you're not going to have a heart attack. So it isn't like a fire and forget. This has to be part of a routine, or it's meaningless. It has to be, again, I would probably recommend at worst once every 2 years. But again, if you say, hey, look, I've got a family with terrible genetics, everyone in my family has had cancer or some medical, I really want to stay ahead, then I would say, okay, once every 12 months. But once every 2 years is probably a good time to be doing it. But again, it comes down to the individual circumstance as well.
Guess what? We now have meal plans. That's right. 7-day meal plans are now available at youmusttryiit.com. Our team of clinical nutritionists have created meal plans that cater to your health concern. For example, if your weight, thyroid, gut, liver, or brain health is worrying you, you can download a meal plan including recipes for breakfast, lunch, dinner, and snacks. You'll find our Mediterranean and menopause plans there as well. So take the guesswork out of knowing what to eat and how best to support your body. Go to youmusttryiit.com, click on meal plans, and let's get cooking. Dr. Zane, as the name suggests, Mermaid Beach Radiology, you are at Mermaid Beach on the Gold Coast. Look, we're glad you're doing it, but why is it only you?
So, a great question. Technology is not automatic. It's not like there's a button that says, be perfect, press here. So technology takes a lot of very focused people who are very good at their job to drive it, managing to attract really good people. And we just seem to be this hotspot of just absolute nerds who just want the best out of each machine. In particular, a guy called Ben Kennedy and his team, Damien, Helen, Alex, and Aaron, they're basically all computer nerds, absolutely love their job, and that passion, which you cannot buy and you cannot fabricate, it's just there. It's either built in or it's not. These people have been pushing the MRI science of whole body for probably the best part of a decade. Now, the big problem with whole body MRI is the main cancer sequence is a sequence called diffusion. So diffusion is a measure of loss of Brownian motion. I won't get into the physics too much, but basically it's a measure of how much water molecules are moving. We know that cancer is hypercellular. We know it's a very dense collection of cells. The water molecules in that are fairly trapped and they don't move. And that's what the cancer sequence diffusion is basically measuring. Now, there's a few organs in the body that are also very dense, which we know, like the ovaries, the testes, the spleen, and lymph nodes are very, very dense. So on this diffusion, they show up white. They show up quite bright, like a bright spot. But we know the normal physiology, so we're not worried. But when we see that whiteness on areas that we know, like the pancreas, or maybe in the bowel or in the liver and so on, then we know there's some badness there. The problem with diffusion is, as good as it is, it's very susceptible to movement. And unfortunately, the patients that we scan will breathe an awful lot. So trying to find precise anatomical location for a tiny little spot, which might only be 5 millimeters in a breathing abdomen, can be quite a challenge. So Ben and his team have developed this thing called inline geometric correction. So we can, through measuring the movement of the diaphragm, we can precisely say through mathematics that actually that, even though it's moving over another number of scans, we can say exactly where that organ is and where that bright spot is. So we can actually tag it to that organ. So diffusion's been around for a while, but it's only because of that geometric correction that we can basically say where the white spot is and which organ it's in. And then hopefully, or hopefully not, it's cancer or not cancer.
So you and your team really are setting the gold standard for full body MRIs here in Australia. Is this technology available anywhere else in the world?
Look, it is. The sad thing is it is available, but a lot of the places it's only available on a 1.5 Tesla scanner. So it is available on a much, much weaker scanner. And a 3T Tesla it's not linear. I think it's algorithmic. So it's probably a 3T scanner is probably 4 times more powerful than a 1.5T scanner. The problem with 1.5 and 3T, 1.5, you can get okay images. The issue is when you go from 1.5 to 3, not only are you getting that amplification of signal, you're getting an amplification of artifact. And in fact, there's so much artifact at 3T that you can't see the wood for the trees anymore. So people have then said, you know what, guys, it's easy just to do these whole bodies on 1.5. But at Mermaid, we can actually, through math, we can eliminate that or certainly greatly reduce that artifact. So if you can do a whole body and you know how to get rid of the artifact, 3T is far more powerful and sensitive, signal-rich images. But so again, so a 1.5 scan is better than no scan, but a 3T scan is the best of the lot.
And where can you find those? I mean, not everyone can get themselves to you. Do they have to wait until they're unwell before they can get this availability to this technology in the hospitals in Australia?
Yeah, look, so the hospitals, unfortunately, the hospitals are completely saturated with reactive medicine. I mean, anybody who gets sick, all of these clinics in Australia, they act as a filter. Once you've kind of gone through all these filters and nobody knows what's wrong with you, you end up at the hospital. Hopefully they've got superior machines and superior testing, and they can work out what's wrong with you. So the hospital is completely consumed with reactive medicine. So really, there's no chance that a hospital in Australia will be doing whole body MRIs, which is a shame, because another reason we do this, not just for well people trying to keep healthy, we see a lot of kids from the kids, referred up from some of the kids' hospitals in Sydney and Melbourne, who have got bone tumors and so on. And rather than getting a 3-monthly PET scan, which has a high radiation dose, they're getting the first day PET scan, and then they're coming to us and getting the whole body MRI. We cross-correlate the two scans to see what's real, because like I said earlier, some other normal tissues cause white spots like lymph nodes. So once we have the PET scan, which will give you the hot spot, and we merge it with ours and we can see the nodes or where the disease is, then we can follow them up going forward with the no radiation whole body MRI scan. So that's the other use for it, in particular, is as a PET replacement. It's most useful if you've already had one PET, and then we can use the information from that PET to go forward with this no radiation. And the great thing about that is if you're on a treatment, you don't have to wait 6 months to see if this thing is working or not. You can go and get your whole body MRI in a month and go, my God, the tumor's shrunk or it's doubled in size. Quickly change the chemotherapy to another one. So you don't have to, whereas before you had to wait 6 months and go, okay, is this thing working? That's a long time to wait to see if a disease modifier is working or not.
It certainly is. God, that must actually be the most painful experience of all, I would think, for any parent. So wonderful, again, to know that your technology is available. And look, hopefully, as you said, the speed at which science is moving, the speed at which preventative health is moving, we can only hope that these technologies become more cost effective and more practical and relative for people to have, access to around the country. But at the moment, mate, you are it, and we are very, very thankful you are here. We are seeing this consumer driven need in medicine, I believe, and whether it is through technology, whether it is through holistic approaches, when you've got someone like Chris Hemsworth doing series like Limitless on how the human body functions and how we do need to look after it for ourselves. I know that what you're offering is going to be hugely appreciated, and I know the lineup out the door is going to be long, but there are those other scans that we spoke about that also help us with our health and well-being. We've spoken a little bit about DEXA scans on the Aging Project, about how you can actually measure, your fat density, really, and what is the value of one of these?
There's nothing more valuable than your health. So if you're one of those people that really value their health, BMD plays a really big part in this now. And BMD has evolved from just a bone density. It's way more than that now. A BMD, and certainly we just got a new BMD on Friday, a few days ago, but our new BMD, it not just does the bone density. So if you've got metal in your spine because you've had a fusion, now we can take the bone density from the neck of your femur to see if you've got an increased risk of fracture. It's called a FRAX, F-R-A-X score. Then we can give you a trabeculation score. Then, in fact, if you've got a hip replacement and you've got a spinal replacement, we can still do the bone density on your wrist. Hopefully you don't have a wrist replacement. But there are certainly other targets that we can move to. In that same scan, we can also say how much fat you have in your muscle. It's a measure called myosteatosis. And there is a whole bunch of new literature saying, in fact, scoring, saying if you've got this much fat in your muscles, your risk of some other metabolic early death increases by. So these are all independent factors for reversible diseases of early death. There's another measure called sarcopenia, which is like a frailty index. Again, in the same scan, we can measure your subcutaneous fat, the toxic visceral fat around your organs. We can measure your muscle groups. If you're a gym junkie and you're looking for perfect symmetry and you want to know, do I spend more time on the left leg or the right leg? We measure your individual muscles in your whole body so we can give you that symmetry that you're looking for.
Oh my goodness. So how does this scan work? Is it like the MRI? Do you hop in a full machine, or is this a little body part at a time?
It's a one scan. The beauty of this, if you're claustrophobic, there's no issue here. It's literally I suppose a wand, which is about 20 centimeters thick. It just goes, takes 5 minutes. It's a completely open machine. The radiation dose is so low that the tech who does the scan with any other one of these scanners, they have to leave the room. They basically hit go and they have to leave the room because the radiation dose. This scanner has such a low radiation dose, they can stay in the room with you and talk to you while you're getting scanned.
Oh, extraordinary! That sounds like a good place to start if you're concerned about any of this. And of course, we have been told, X-rays, and you get a little bit nervous when you're standing there all by yourself. Like, what am I doing?
Absolutely. But imagine, so because it's such a low radiation dose, I mean, if you're changing your lifestyle completely, or you're going on a Ozempic, and the issues with Ozempic are that you're losing this and you're losing muscle mass and you're losing bone mass and so on, and you want to get a good baseline before you go on a Ozempic, this is a scan for you. Because it's such a low radiation dose, you could essentially have this every 2 weeks. I mean, it's almost the same radiation dose as walking to the shops and back. I mean, it's almost negligible. Imagine the tech is allowed to stay in the room while you get scanned. It's that low.
How extraordinary. So what are we supposed to do, Zane? Are we meant to call you up and say, look, I'm here, I'm ready? Do I need a whole day for this? How does Mermaid Beach Radiology actually work, and how many procedures can you have at once if you're doing the full car makeover?
Yeah. So look, great question. We've got, believe it or not, we've got three packages. No one ever goes for the middle package. Everyone goes for the top package, and some people go for the bottom package. The bottom package is the whole body MRI. Great place to start. I add into that because the MRI has an Achilles heel, and that Achilles heel is air. So, of course, your lungs are full of air. If you've got a small little nodule, or if you've got emphysema or some scarring, MRI will not be able to show you that. It can probably show you a nodule about 10 millimeters or bigger, but that's a decent size to get the first eye on. So in our basic package, we've got the whole body MRI that you still get in the full package, but it's a very comprehensive whole body MRI. I add into that, it's a CT chest, but it's not a low dose, it's not an ultra low dose, it's a hyper low dose chest. To give you an example, lung screening is starting next year in Australia.
Oh, like mammograms or?
No, sorry, lung screening for the lungs for anybody who used to smoke between the ages of 50 and 70.
Yes, but for everyone.
Anybody between the ages of 50 and 70 who have a smoking history will qualify. The exact details are still coming, but it looks like somebody who's probably smoking a pack a day between the ages of 50 and 70 are getting lung screening. The Americans have done it. The data is fantastic. Not only does it reduce lung cancer deaths, but it's also been shown to reduce all death mortality. So if you had pulmonary fibrosis, cardiac disease, or whatever it is, it's actually reduced the mortality from all-cause death. So it's such a useful tool. So that's starting in Australia next year. They have a threshold or a ceiling for the radiation dose of 2 millisieverts. At Mermaid, our dose for that is 0.16 millisieverts. So we're 15 times lower than the lowest dose for screening. Now, it took us about 4 years to get to that by tinkering with the protocols, but now we have a dose which is just above an X-ray, except it's a CT. So it's such a negligible dose. That's the scan that we pair together with the whole body MRI. So not only are you getting a wonderful scan, but the part of the MRI that's the weakest in the lungs, we are covering that then with an ultra low dose CT, or what we call hyper low dose CT chest.
Amazing. And then you could add a DEXA onto to that as well.
Correct. So in the higher package, then we'll do a calcium score. And then we'll do the DEXA, we'll do that full muscle map and the fat map and all that kind of thing. We'll give you all those numbers. And then we do a whole bunch of separate ultrasounds. In the top package, again, we'll do a dedicated prostate MRI, dedicated breast MRI. And then we'll separately look at things like the thyroid, like the back of the eye to make sure there's no melanoma in the back of the eye, and a few other bits and pieces. So our top package is basically everything I have in my toolbox without without contrast or without invasive testing, the maximum product I have in my armamentarium, that's our top package. Like there's nothing, like if somebody said, here's $1 billion, Zane, what else would you do? There's nothing else. That our top package is our top package. There's nothing else I have to offer.
It doesn't cost $1 billion, everybody.
No, not even close.
But look, again, what's your health worth, I guess, is the point. And in the future, hopefully, this is available to everyone. Not that I want to do you out of business, mate, but you would love to see everyone in Australia be able to access this kind of visionary medicine. I really think it is that. For women over 40, is there anything else that we could or should be doing in your eyes for our own personal health practice?
Aside from the whole body MRI, absolutely the DEXA. I mean, osteoporosis is just, the slip, slop, slap messaging, it's a very good message. The thing is that it's almost too good. We have kind of, as a country, and I know we have the highest melanoma rates in the world, but we have almost avoided the sun at all costs. And a few large papers have come out recently that have shown no association with exogenous, which means supplemental vitamin D, and your rates of osteoporosis. Vitamin D tablets have not helped the osteoporosis epidemic in Australia. So how do you get that? It's basically strength training, and you do need a bit of sun. And in fact, a few papers have come out recently that have shown that yes, sun can cause cancer, but not in the way you think. The Northern Europeans who go to Greece for their 2-week sun holiday and get a year's worth of sun in 2 weeks, that's how you get your sun cancer. The people that we see on the Strand here on the Gold Coast who are in the sun shirtless every single day of their lives, who look like a saddlebag with eyes, never get cancer, never get melanoma, or extremely rarely. It's protective. It's all about, just like radiotherapy. Well, we know radiation causes cancer and can kill. So how are we using radiation as a therapy? It's because we fractionate it and we give a small dose over time. And that's how it has a therapeutic effect and not a detrimental effect. So it's all about how you get that energy. Do you get it in a small 2-week sun holiday in Greece, or do you spread it out over 365 days of the year? And it's the spread of the energy that you absorb is why it can be used as a therapy, and it's not that dangerous.
That's going to be a really tough message, as you say, to a population that is grown up with that cover up, slip, slop, slap, to then tell, 40, 50, 60, 70-year-old women that, hey, you're allowed to go in the sun. We are so cautious and sensitive now, and even our skin's very, very sensitive to the sun now.
Correct. No, absolutely. But look, I'm not a dermatologist, so I don't want to get out of my lane too much. But again, it's that same principle. If you take it over, just like, any drug, you take a drug, if you take a year's worth of that drug in a day, you'll die of an overdose. But if you take it small amounts every single day, it's beneficial. So it's all about how the rate that you get that energy of the sun. So, 5 minutes a day, 6 minutes a day, it's protective. But 8 hours in a day, that's where you're going to do yourself damage.
Zane, for someone who's literally seen the inside out of hundreds of patients, are you noticing any trends, let's go with the over 40s and particularly women, that have become more prevalent in the time that you've been working with this machine?
Yeah, I'm definitely seeing a slow rise in young women lung cancer. And I'm not sure why that is, but certainly there seems to be an overall decrease in lung cancer in men, but there is a slow rise in lung cancer in women. And I'm not sure if it's well understood. I know that that's also one of the drivers for having a lung screening program in Australia. I've read a few theories of why that might be. Women are doing more and more house renovations. There's more asbestos in those old houses that they're renovating, increasing smoking rates, although I think smoking rates overall are decreasing, but it's relatively increasing in females. Of course, that's probably being replaced now with e-cigarettes and vapes. So that's an interesting one. We touched earlier on pancreatic cancer, and I think that's a general pollution thing. Another cancer that we're seeing more of is breast cancer in young women, and I think that's like everything in life, that's multifactorial. Is it women postponing having children, focusing on career a bit more, and then having children later on in life? So I'm not exactly sure, but I'm seeing a lot of breast cancer in young women. Now, incidental breast cancers we're seeing a lot of, and I think that's probably a few reasons as well. I'm getting more and more oncology referrals. So I'm probably seeing more of it from that point of view. But also, one of our cameras is a spectral CT scanner. There's only 3 of them in private practice in the country. But a spectral CT scanner is nearly the same as a mammo scanner, in the sense that I'm using an energy of X-ray which is very close to mammography, which is around the 40 kiloelectron volt. So the spectral CT has a range between 40 and 200. But what it means, I look at all my images on the 40, which is just about at the same level as mammography. So we pick up a lot of breast cancers, and I'm talking breast cancers way before a woman can even self-exam and feel that. One of our first cases of whole body MRI, we had pretty much been scanning ourselves and relatively happy with the product. But one of our first cases, a lady just came in and she was kind of a bit frustrated. She was saying, I know there's something. She was a lady in her 70s. She was, but very well read, very educated, smart lady. She was, she just knew that there was something wrong. She didn't know exactly what was wrong. She was a bit dissed by her GP, or not taken seriously. And she said she would like to get a whole body MRI. So again, she was one of our almost guinea pigs, and we said, "Look, it's a 2-hour scan. You'll be there, and watch a movie, etc." And she didn't mind, and we didn't mind doing it. The whole thing was done for free. At the end of the 2 hours, we had a look. She had metastatic breast cancer, and she had an 8-centimeter lesion in her breast. So I spoke to an absolutely gorgeous woman, and I spoke to her afterwards, like, you've got this disease here in your breast and it's spread and so on. And I said, look, how could it get to 8 centimeters and you couldn't feel it? She said when she was younger and she couldn't afford a breast implant, she was on holidays in Hong Kong and she found a doctor in Hong Kong who free injected silicone all around her breasts. And from that moment, so no, not encapsulated silicone, just free silicone in her breast. And she said from that moment, she had lumpy breasts. She could never self-exam. And that's how this 8-centimeter monster grew, and she just couldn't feel it because her breasts were always lumpy. And that's one of our first cases, and it's actually up on our website as we speak. If you go to our whole body MRI page, you'll see a 3D spinning, and you'll see this big black blob in her breast, and that's her breast cancer. But it was that case that went, my God, this is the right test. We're onto something here.
Yes. Can you give me another example of a patient? Obviously, no names.
Yeah, we recently had a guy who took our whole package, and he actually flew up from very focused on being ahead of it. I think he was a gentleman who recently sold a business and did quite well, and he was like, okay, I've focused on the business for so long now. Now it's time to focus on myself. So he came up and he said, I just want your top package. And he came in and we did everything, and we did the dedicated prostate. Again, this is a guy in his 50s, well, healthy, completely asymptomatic. And we did his prostate, and he had 2 of the highest grade prostate cancers in his prostate.
Oh, God.
So then he went and saw his urologist. Urologist did his, he got another test called a PSMA nuclear medicine PET scan and confirmed the MRI findings. He went and had the biopsy, confirmed highest grade, and he had robotic surgery, and it was all taken out.
Unbelievable.
And completely asymptomatic, yeah. So, when those kind of stories really spur us on. In fact, I mean, every time we see one of these positives, we all get together and just go, look at this, guys. And, okay, we've got it. Is there anything we could have done to make it better? I mean, we make 4 or 5 changes a day. I mean, the iterative process is just phenomenal. We just don't stop, and we agonize over every single image. It's a real work of love, or labor of love.
Back in season 1, episode 12, we learned about the benefits of collagen from the amazing Dr. Frank Lipman. It was that conversation that saw us researching the best possible collagen products we could find for us and for you. I'm excited to say our favourite brands now available inside our sister platform and store, youmusttryit.com. You'll also find a range of fabulous products from gynecologist Dr. Anna Kebeka, who we interviewed in season 2. I absolutely love her maca powder and keto green protein power. After today's episode, perhaps go back and listen to episode 2. It's called Let's Take a Menu Pause with Dr. Anna Kebeka. It's worth a listen. Okay, my friends, now back to today's episode. Look, being at the forefront of all this technology and obviously having access to the latest things coming, where do you see medicine going in the future? And does AI play any part in this? What do you know that's coming?
AI is here now, and I use it every single day. And AI misses some stuff and it overcalls, and that's okay. But it's an extra set of eyes that doesn't get tired, like me. And I'll always do my own read. I'll run it through the AI, and I'll see if it's picked up something that I haven't picked up at. And the two of us work well together. There's no arguments. So where do I see medicine heading? I reckon in 10 years' time, you will go and see your medical geneticist. You'll get a map of your DNA. You'll find the faulty genes and the end organs that those faulty genes affect. And then we'll get a short list of what those organs are, and you'll put them on the radar. And the radar, like we said before, has to be a camera that doesn't cause cancer, because we're trying to prevent cancer. So you'll get your genetic tests, faulty genes, faulty organs that they affect, whether it's pancreas, whether it's prostate, breast, and then you'll get extra special MRI scans of those faulty or potentially faulty end organs, as well as your whole body. And then we basically wait for it to develop or not to develop. But at least we've got eyes on. So if something does happen, we have caught this thing at its earliest stage, which is your best chance of a favorable outcome.
I tell you what, when I first started taking an interest in this, and it was only when Amanda came to me with the Aging Project and said, hey, we should really start thinking about our older selves, all this stuff really, I'll be honest, scared me. It freaked me out. And now having had conversations with you, with Yal Joffe, who is right up there in the epigenetics zone, with Sergey Young, who is one of these sort of futurists. It's extraordinary. And again, all the guests that we've had, I really do feel like this is an awakening. This is sort of a coming of age for medicine and holistic practices all joining together. And I feel like, as you say, within 10 years, we're going to be in a really positive and proactive space. And that excites me.
Absolutely. No, it's a very exciting time in medicine. But just even getting ahead of disease is just it's the most beautiful thing to find. I mean, again, medicine to date has been somebody walks off a cliff and we try and piece them together. But medicine is changing. We are now going to be the guardrails at the top of that cliff and trying to stop you from falling off that cliff. And that's where genetics and whole body MRI, two of the big pieces of that puzzle, will be at the forefront.
Zane, we had another guest on the show who has an incredible story, Kate Malvernon. She is a 2-time survivor of terminal cancer, and I know that she has been in to see you and on her Instagram again documented her trips to see you. Look, she's an extraordinary story, full stop, and obviously her ongoing proactive care of her health and staying in front of cancer is something that she documents very deeply on her Instagram. I mean, what an extraordinary story and an extraordinary woman that she is.
I get goosebumps every time I think about Kate. Like, what a story. I first came into contact with Kate just after her first round, and she had a favorable result. And so I wasn't there for the initial cancer diagnosis and so on. At the point she came to me, she was pretty much handed over. The hospital had said there's nothing more that we can do. She rolled up her sleeves and basically took ownership of her disease. And I honestly can't comment on her treatment because I don't exactly know what she's had done. I know she's flown to Mexico and a few other places, but from an imaging point of view, she came to me at the end of her first trip, I think, to Mexico, and she got a whole body, and effectively it was clear. Then it was about a year later, and that's back to the point of everything that you do with whole body MRI, it's a part of a permanent process. It's not a fire and forget. It's a snapshot in time. So she had a whole body MRI, and I confirmed that yes, there was no metastasis. Then we didn't see her for about 18 months, and she came back, and I got a phone call from her doctor saying that she was coughing up blood. So we got her in. Worst news possible, she had metastasis everywhere in her brain, all throughout her lungs and in her liver and so on. So we did that scan, and we broke the news to her. Again, in fairness to, she's such a strong woman. She, again, rolled up her sleeve, goes, okay, I know what I have to do. So she did her, whatever it was she did, off to Mexico. And I didn't see her for about 3 months when she came back. I understand that she had a few scans in Mexico and it was said to be all clear. Her doctor called me and said, Zane, be gentle, give her some hope. I'm like, I always have to be truthful. I will break the truth as gently as possible, but my job is to be truthful. I can't not be truthful, or anything I say after that point will have no effect. She'll never believe the good news when I give it, if I don't give her the truth when the bad news is to be delivered. And I said, look, I'll only accept a scan that we do, as for in terms of how she's progressed. So she came in and she got all the scans. And I honestly, if I didn't scan it myself, I wouldn't have believed it. She had metastasis the size of almonds all throughout her lung and her brain. There was virtually no sign of one of them. I don't know what she's doing, but she'll definitely have to write about her experience, because I'm sure there'll be many people in her boat. But she's a woman in her 40s, young child. I mean, when someone tells you you've got terminal cancer and there's nothing more they can do, you can't just throw yourself in a heap in a corner. You've got a child you have to fight for. So she did everything I would have done. She rolled up her sleeves, she took ownership, and she went out and sought, yeah, okay, maybe it was fringe medicine, but it's only fringe medicine if it's not working. From what I could tell, it blasted this stuff away.
Mm-hmm. And how extraordinary for you to be a part of this story now. And I guess, from a science and medicine perspective, she's a really interesting case. But now I imagine you guys have been through a lot together. It must be extraordinary to see her battling on.
No, we consider her. Yeah, no, we consider her a friend at this stage. So she's a friend of myself and my wife and Mermaid. So we're all excited every time we see her. And we're even more excited to give her the good news. I mean, I just hope I never have to give her bad news again. But it's an absolute remarkable story.
Look, and if you did, you would have got it early and you battle on together.
Correct.
For someone who's probably faced with mortality every day, what does it mean to you to age well? What do you live by?
Yeah, so I mean, I'm no Chris Hemsworth, as you can probably tell, but I mean, I believe it or not, I'm in the gym every single day, but I'm only in there really for cardiovascular health, and just general kind of well-being. It's a time I can just sit and reflect and de-stress. I mean, my body isn't even for me anymore. It's for the kids. So everything I do is really about making sure that I'm healthy and can be keen mind, to help my kids through this difficult experiment called life. But it's just doing small little things every day the right way. Try not to let yourself get too hungry where you make bad decisions. Try not to be impulsive. Don't get yourself into a situation where you have no option.
Yeah, that's a pretty good one. I like that. Do not let yourself get too hungry or you make bad decisions. Absolutely right. Dr. Sherif, I know you and your wife, Dr. Kiralee, have worked tirelessly, not just to be able to bring Mermaid Beach Radiology to life, but each and every day working with the patients you've got. And as I said, I'm thrilled you're here, and I'm glad I've had the opportunity to go through the process, and certainly have it on my yearly medical calendar that I must come back and have another one. I have no hesitation in recommending this to everyone. I think really is, as we've said, the future of preventative medicine, a wonderful baseline for everyone to start with. If you'd like to know more, please jump on these links. We'll have them in our show notes, but it's mermaidbeachradiology.com.au, and their Instagram account is extraordinarily it's just a great place to go if you need more information, and there's a lot of diagrams and a lot of images there of how the whole process works. So check that out too, mermaid_beach_radiology. Zane, can't thank you enough for what you're doing for medicine here in Australia. Really, really appreciate it. And hopefully we can get some of our fabulous community up there to see you. And look, take a long weekend on the Goldie and book in for a scan.
Absolutely. Thanks, Shelley. Thanks, Amanda. And we answer every email. So any questions, please just fire away.
Brilliant. Thank you, mate. Speak to you soon.
Thanks, mate. Bye-bye.
That was a great conversation. As we can see, the future of preventative imaging is here, and it is exciting. I did learn that MRIs, like cars, are very different. And what Zane is offering is the Rolls Royce, the very best technology, so that we can get ahead of diseases like cancer as quickly as possible. We need private and independent companies like Mermaid Beach Radiology to help push the boundaries for change. So please go and check them out. And if at this point a full body MRI scan isn't available to you, please know that change is coming and look into perhaps a DEXA scan that you can get locally. Remember to tune in to your intuition if you sense something isn't right. Like the client story that Zane shared, insist on an MRI. They are incredible. Remember, we are the CEO of our own health and we have to advocate for ourselves. A final point on genetic testing. Zane mentioned it a little earlier in our chat. For those that haven't heard, the Aging Project has partnered with Fit Genes to offer our community the best genetic test available here in Australia. If you'd like to learn more, click the Fit Genes link in the show notes and sign up for our waitlist. Thank you again so much for listening. This is Shelley Craft on the Aging Project podcast. I can't wait to talk to you again soon. A final thing before I go. If you enjoyed today's episode, can I ask two small things of you? Can I ask you to share it with someone you love? We would be so grateful for your support and help to spread the aging well message far and wide. We want everyone aging well alongside us. And if you wouldn't mind subscribing to the podcast, it helps more than you know and means you'll never miss an episode. Thank you so much. Until next time, I'm Shelley Craft, and this, my friends, has been another episode of The Aging Project. As always, the Aging Project podcast is for educational and entertainment purposes. Always seek medical advice from a qualified practitioner.